Okay, picture this for a second. Your smartwatch, maybe picking up tiny changes in how you sleep, and it flags a potential health issue, like weeks or even months before you feel anything wrong.
Hmm.
Or think about a new illness popping up somewhere else in the world, and almost instantly AI systems are tracking it, helping us figure out, how to stop it spreading.
Yeah, that's not science fiction anymore, is it?
Not at all. It's this really exciting future being built, right, where epidemiology and artificial intelligence meet. And that's what we're going to dive deep into today.
Absolutely. And epidemiology, well, think of it as the original detective work for public health.
Right.
It's all about figuring out how diseases spread through populations, who gets sick, and crucially, why. Historically, I mean, this was really painstaking stuff.
Well, doing maps.
Exactly. Mapping cases, looking for common links. It's how we cracked cholera, how we linked smoking to lung cancer, and ultimately how we got rid of diseases like smallpox. Real detective work.
That classic boots on the ground investigation. But things are more complex now, aren't they? We've got chronic diseases everywhere. Infections can jump continents overnight because of travel.
And everyone wants healthcare tailored just for them.
Exactly. So those traditional methods, they start to hit some limits. It feels like looking for one specific grain of sand on a huge beach
It really does. And that's precisely where AI steps in.
because of the data.
Because of the sheer overwhelming amount of health data we have now. Everything from your personal medical history, genetic information, wearable data, all the way up to global environmental factors. It's just vast.
Impossible for a person to process.
Right? AI and the whole big data toolkit gives us the power to sift through all that information at a speed and scale humans just can't match. It lets us find these really intricate patterns, connections that would otherwise just stay hidden.
Okay, so let's get specific then. How is AI actually changing the game day to day for our health? Maybe start with something like finding illnesses early. That seems huge.
It is. And one of the most groundbreaking areas is how AI analyzes medical images.
X-rays, scans, that kind of thing.
Exactly. X-rays, CT scans, even retinal scans, pictures of the back of your eye. We can train AI using massive libraries of these images.
So it learns what normal looks like and what doesn't.
Precisely. It learns to spot these incredibly subtle patterns that might signal the very early stages of diseases like, say, breast cancer or diabetic retinopathy or melanoma, sometimes even flagging things before a human expert might catch them.
Wow.
Think of it like an incredibly sharp-eyed assistant who never gets tired, always providing that second look.
That's pretty amazing. And it's not just about pictures, is it? I've heard AI is also looking at other kinds of data to predict problems.
That's right, using something called predictive analytics. AI can look at patterns across your electronic health records, combine that with data from wearables,
Yeah.
your fitness tracker, your watch,
Sleep patterns, heart rate variability.
all of that. It looks for combinations of factors that might indicate someone's heading towards a serious condition, like sepsis developing in a hospital patient, or even estimating the risk of developing something like Alzheimer's disease much further down the line, potentially years earlier than we could before.
That's incredible potential. But it's still a tool for the doctors, right?
Oh, absolutely. Critical point. AI here is an assistant. It's designed to empower healthcare professionals, give them better information, flag potential issues. It's not about replacing their judgment or expertise.
Right, it helps them make even better decisions. Okay, so that's detection. What about actually treating illnesses? This whole idea of personalized medicine keeps coming up.
Yeah, and AI is a major driver there. For one thing, it's dramatically speeding up the process of discovering new drugs.
How?
Well, it can analyze, millions of molecular compounds, the basic building blocks for medicines, to predict which ones are most likely to be effective against a specific disease target, far faster than trying them out one by one in a lab.
So finding the needle in the haystack much quicker.
Exactly. But it goes further. AI can also help predict how well a specific drug might work for you personally.
How does that work? Based on my genes.
Based on your genes, yes, but also your lifestyle, maybe the specific subtype of your illness, other health conditions you have. It integrates all that complex information.
So moving away from the one-size-fits-all approach.
Definitely. Think about cancer treatment. AI can analyze the specific genetic mutations in a patient's tumor.
It's unique fingerprint, basically.
Exactly. And then identify targeted therapies that are most likely to work against those specific cancer cells. Or, on a different note, AI could help design a nutrition and fitness plan tailored to your individual metabolism, your gut microbiome, your health goals. It's about getting much more precise.
That sounds like a much smarter way to approach health. Okay, let's zoom out a bit. Public health things like tracking disease outbreaks. How's AI helping there?
This is where AI's ability to process vast amounts of information in real time is, well, transformative.
So it's constantly scanning.
Constantly. AI systems can monitor global news feeds, social media chatter, airline travel data, even environmental sensors, like analyzing wastewater for signs of viruses.
Wastewater, really?
Yeah, it's becoming a really valuable tool. It's like having this global, constantly vigilant early warning system looking for sparks that could turn into fires' potential outbreaks.
Like a super sophisticated pandemic alarm, and I gather these systems are getting better all the time.
They really are. As of now, May 9th, 2025, these systems are significantly more sophisticated, more interconnected. They don't just spot signals. AI can then model how a disease might spread.
Predicting the path.
Predicting the path, identifying which communities might be at highest risk, and helping public health agencies figure out where to send resources, tests, vaccines, personnel to contain things quickly.
That's a huge leap for global health security. Okay, thinking about our everyday interactions with healthcare. How is AI making things, I don't know, smoother, more accessible?
Yeah, that's another big piece. Think about AI-powered virtual assistants or chatbots.
Like the ones you chat with online.
Exactly. They can provide reliable health information 24/7, help people manage chronic conditions like diabetes from home, remind them about medication, or even do an initial symptom check to guide them on whether they need to see a doctor or go to the ER, or maybe just rest at home.
So it could take some pressure off the system, answer common questions.
Precisely. It frees up doctors and nurses to focus on more complex cases. And behind the scenes, hospitals are using AI too,
How so?
to optimize workflows, predict patient admission surges so they can staff appropriately, manage operating room schedules, ultimately trying to reduce those frustrating wait times.
Anything to reduce wait times.
Tell me about it. And crucially, when you combine AI tools with things like telehealth, video calls with your doctor and remote monitoring devices, it really starts to break down geographical barriers. It can dramatically improve healthcare access for people in rural areas or underserved communities.
It really sounds like AI is becoming this incredibly powerful layer, amplifying what humans can do in healthcare. But it's not working alone, is it? You mentioned collaboration.
That's absolutely key. The future isn't AI or humans. It's AI and humans working together. It's a partnership.
So what does each bring to the table?
Well, AI is brilliant at processing immense data sets, finding correlations, spotting anomalies humans might miss. But humans bring the context.
The real-world understanding.
Exactly. Critical thinking, ethical judgment, empathy, understanding the nuances of a situation or a community. AI spots the what, humans figure out the why and the what next.
Can you give a practical example of that synergy?
Sure. Imagine AI identifies a neighborhood with surprisingly high rates of type 2 diabetes. It might correlate that with data on, say, fast food outlet density or lack of green space.
Okay, data points.
Right. But then the human epidemiologist takes that insight. They go into the community, talk to people, understand the local culture around food, the economic constraints, maybe transportation issues affecting access to healthier options, the social factors.
The stuff the data doesn't always show.
Precisely. And based on that, combined understanding the AI's pattern detection and the human's contextual knowledge, they can design targeted interventions that will actually work for that specific community.
Yeah.
Maybe it's cooking classes, maybe it's advocating for a local market, maybe it's mobile health screenings.
That makes so much sense, combining the strengths of both. So if we manage this integration well, the potential upside for health seems huge.
It really does. This fusion of epidemiology and AI, it's not just an incremental improvement. It's looking like a fundamental shift in how we understand and manage health and disease.
We're talking earlier detection.
Much earlier detection. Treatments tailored to the individual, not just the average patient.
Yeah.
Public health that's proactive, anticipating problems instead of just reacting.
And potentially making good healthcare available to more people wherever they are.
Exactly. Better access, better outcomes.
So when we look ahead, are we maybe heading towards a future where this AI-powered epidemiology helps us live not just longer, but genuinely healthier lives, where preventing disease becomes the main focus?
That's the vision, isn't it? A future where public health is truly preventative, driven by intelligent insights. It's a profound idea.
It really is. It definitely encourages you to think about the incredible possibilities unfolding and how quickly health innovation is moving.
Absolutely. The pace is quite something.
Well, this has been a fascinating deep dive into how AI and epidemiology are coming together. It really paints a picture of a rapidly changing health landscape. And for you listening, what part of this fusion gets you most excited? Or maybe What gives you pause? Definitely a lot to think about as this continues to evolve.